Ward here for OptimumSportsPerformance.com, and today I'm going to show a short little video on Popliteus treatment for my friend Joe Heiler of SportsRehabExpert.com. So we're going to show some of the ways, or two of the ways, that we treat that muscle. What we need to know about that muscle is that its attachments are on the medial portion of the tibia, on this proximal 1/4 or 1/3 aspect of the tibia on the medial side, and then it comes around or across the back of the knee and attaches onto the lateral aspect of the femur and partially into the lateral meniscus. Some of its roles are to help flex the knee along with the hamstring musculature and the gastroc. As well, it kind of serves a rotational purpose, and that rotational purpose changes whether the person is in the open chain or in the closed chain. So here in the open chain, it's an internal rotator of the knee, and in the closed chain, it would be an external rotator of the knee. And sometimes it's called the key to the knee because it helps to unlock the knee when the knee bends, especially in movements of walking or squatting down or standing. Its trigger point referrals will be right around the back of the knee, sometimes similar to or mimicking a meniscal problem or pain with flexion of the knee. So I'll go ahead and I'll show you two different ways that you can treat this muscle with either general gliding strokes or compression and then a pin and stretch type of technique. Okay, so as you can see, we've got the client prone on the table, and remember, the attachment is right here through that medial proximal portion of the tibia, so it'll be underneath the gastroc and soleus muscles. We can take lotion or even just work with a dry, work dry on the person. We can go right into that medial 1/3, and actively we can have them extend the leg as we glide up through there, and we'll also be influencing and treating, again, the soleus and gastroc with this treatment, since the popliteus is a relatively deep muscle. And so we can go with our gliding strokes up as they actively or passively, like I'm doing, flex their knee, flex and extend their knee. We can use lotion and go with gliding strokes. The way to treat this muscle on its more proximal attachment is we're going to go ahead and we want to find the tendon of our hamstring musculature, our biceps femoris, which is coming down and attaching onto the fibular head, and our IT band. So what I'm going to have the client do is gently flex their knee. So I'll give them some gentle resistance, and I can see those two tendons pop right up, and I can compress right in between them, trying to get onto the lateral aspect of the femur. And the gastroc, again, is going to be also attaching onto here, and it's a relatively deep area. Sometimes you can internally and externally rotate the lower leg and feel that muscle pop underneath my finger. Again, I can hold static compression, or I can pin and stretch the muscle. So I'm going to start with it on internal rotation and flexion. That would be its shortened position in the open chain, and then I'm going to extend it and externally rotate and maintain my pressure right there on that structure. The popliteal area, or the popliteal fossa, is a pretty neurovascular structure. There's a lot of things running through there, so you just want to make sure that you're lateral to that tendon of the biceps femoris and medial to the IT band tendon. When you do this on your clients at home, you're going to see those two pop when you give them a little bit of resisted knee flexion. The pin and stretch on the medial side is kind of similar to the gliding stroke I just showed. We can use either our close hand or our foot side hand or our head side hand, depending on what's most comfortable to you. Again, we would start with internal rotation and flexion. I could take my contact right onto that area of the tibia, the medial tibia, and I can go ahead and extend and externally rotate. That would be with my foot side hand. For some people, it may be more comfortable to try and take it from their head side hand and work downward and we're just holding our pressure. And then of course you can also get in with your thumb and do the exact same thing. So either of those techniques will work to try and treat or influence the Popliteus, and hope you found that helpful.